Ton, welcome to the Thriving in the Age of Disruption podcast series. I wanted to start off by having you introduce yourself to our listeners. Please share a little bit about your background and your family and where you're living.
So the elevator version of my life, I'm a medical doctor and I was born in Holland, raised in Holland, educated in Holland for the most part. And after my internships and residencies, I started work for Doctors Without Borders, first in Somalia, very briefly, and then later in Cambodia. And that was supposed to be a brief job, but I ended up staying in Cambodia for 8 years. And while there, I made the transition from being a medical doctor, a surgeon, and going to more public health oriented work. And I did a lot of consulting in the region, mostly in Southeast Asia. When I was in my early 40s, I met this wonderful woman, settled down, married, and we lived and worked in Egypt for a number of years, had 2 daughters there, moved to Vietnam, had a son there, and we stayed in Vietnam working for nonprofits for about 10 years. After those 10 years, there really wasn't a lot of need for my kind of nonprofit work, and we started for-profit home care agencies.
Wonderful. Thank you very much for that introduction into the different things that you've done in your life in terms of being trained as a medical doctor, practicing as a surgeon, then going on to working in the public health care system, the NGO space. Now have become an entrepreneur. And it's wonderful because I'm going to ask you a few questions about entrepreneurship. And I define entrepreneurial mindset as being resourceful in life. So if you have a problem, you're trying to figure out what to do, how to pivot, how to adapt. You're also able to deal with uncertainty or manage risk. But most importantly, you're able to bring value to creating something which was not there before. So you've had this journey where you've moved from being a professional trained medical doctor to someone who went into public service and consulting work, and then to NGO work, and now to an entrepreneur. What was that whole motivation and what was entrepreneurial from an entrepreneurial mindset that you saw in all these moves?
Let's start in Cambodia, where I ended up in the early 90s after my residency years. I was doing basic surgery, obstetrics and gynecology there in a provincial hospital and training Cambodian doctors. And that was very much, if you will, medicine on a retail basis. I was providing one-on-one care. And I distinctly remember doing a cesarean section for a woman, and it was her 13th pregnancy. And this was a very poor family that barely managed to feed the first 12. And in tears, she asked me before the cesarean if I could please make it so that she didn't have any more children. And so, of course, I did a tubal ligation at the same time. And for her, that was a very important moment, that she was no longer tied to her reproductive role in life, that there were other possibilities for her. And that inspired me to start a small family planning program in the province where I was working. And at the time, that was not particularly easy because Cambodia still had no family planning program. And in fact, there was a distinct policy to sort of grow the population as fast as possible. And for me, that was a moment where I thought, well, I can keep doing medicine on a retail basis, but maybe what I should be doing is do more of these family planning programs and work more in public health, because I'd be able to reach more people. Reaching scale was very attractive to me, to be able to have more of an impact on the world around me. And so I went back to school and did a master's in public health. and was fairly convinced that investment in family planning and birth control and female education is really the key to helping people, not just in healthcare, but also in lifting them out of poverty and emancipating and strengthening females. And so the next 30 years or so of my life, I've spent in trying to start up and strengthen family planning programs.
Wow, that's really inspiring. I remember I had a conversation with someone about the ramification of the business as usual way in which people reproduce and the impact that it has on communities, especially women who maybe even burdened with that as a primary role, and how it is also part of their empowerment and emancipation when we can give them the choices to.
Absolutely. It's a huge factor in how a woman's life plays out in how much control she has over her reproduction, about the number of children she has and the timing that she has them at. It has a huge impact not only on her family life, but also on her career, on her working life, on the amount of money that she can earn, that she can then use to feed and house and clothe the children and educate the children. And I find myself, after 25 years, since 2015, living in Vietnam with 3 kids in school, and they don't want to move. They're happy that they've lived their whole life here. And the Vietnamese family planning program is running on rails. It's a well-organized, well-executed government program. And there's not a lot of need for my services anymore. And I look around together with my business partner, Ron, and we recognize that there's another sector of the population that is vastly underserved, and that it's mainly the elderly, and particularly in home care. So we decided to try to kickstart that, and we started a company to provide those services.
And what have been some of the ups and downs or the challenges that you've had to navigate?
I would say the biggest challenge is that it's not just starting a home nursing care agency, it's starting a whole new business sector. And it's a business sector that nobody is particularly familiar with, not in the regulatory agencies. And so it took us almost 2 years before we figured out what the licenses were under which we could provide the service. And not in the rest of the medical sector. So the hospitals don't know it, and people in hospitals are not familiar with referring patients to home care agencies when they need more care after they discharge the patient. Families are not familiar with the concept, and so they don't know to call when they have somebody who needs care at home. There's a huge need, but the demand is still quite small because people are not familiar with it. That's probably the biggest barrier, if you will.
You've correctly pointed out you're creating a whole new industry. And as the early adopter, you've got to educate and create the need. The people who will come behind you as your competitors will have it much easier because you're paving the way by creating that whole business model, the need from consumers for this kind of services.
That's true. Well, we're creating it in Vietnam, but of course, there are many countries around the world that already have thriving home nursing care sectors. So it's not something we're inventing. And in terms of competitors, we'd be happy to have some serious competitors. The amount of work that is available is enormous. And if there were more companies jumping into this and trying to educate the population and also the rest of the medical sector that this is available, it's an important service to lean on. I think the rising tide of recognition would lift all the boats. Well
said. And where are your clinics or facilities available right now in Vietnam?
We're in the 2 largest cities in Vietnam, in Hanoi and in Ho Chi Minh City.
And what's the aspiration in the next 2 to 3 years?
We'd certainly like to expand to a couple of other provinces. with new agencies, but also we'd like to expand within those two cities with some smaller nursing stations that are, if you will, closer to the community, where the staff can become familiar with the local community, with the community leaders, and become a community asset.
I guess what you are talking about is not the traditional kind of nursing care whereby I would be in a hospital or a facility, but really someone is actually coming to my home, taking care of me, right? And it can be, depending on what I'm dealing with, it can be a 24-hour shift, it can be a partial, maybe the evening night shift, or it can be just coming to attend to a wound or maybe doing some specific tests, depending on what my needs are.
Yeah, that's exactly what we do. Yeah, that's a good description. And
Yeah.
it ranges from 24-hour palliative care to people who are close to dying, to dropping in once every month to check on somebody's blood pressure.
Wow. I wish you had this service in Singapore because we don't have a model like this.
Yeah,
And
I think that in Singapore also there are a number of people trying to start this up. It's not just the fact that the population at large or the rest of the healthcare sector is not familiar with the model. It's also not easy to find nurses who are able to do it, since they're in countries like Singapore or Vietnam, where the model doesn't exist. The nurses are also not trained to do it that way. And so nurses graduate unfamiliar with this kind of work, and that makes it also a little bit more difficult.
When I look at my aging mother and the fact that I have full-time work, sometimes having that professional care or medical care at home makes it really comfortable for her as well as myself. And knowing that I can, call on such a service is, I think, very important, especially as countries and communities and societies confront aging.
Yeah, and I think that group that confronts aging in place is only growing. People are confronted with chronic diseases, diabetes, hypertension, stroke, cancer, and all those people are sick with those conditions. They really don't want to spend too much time in hospitals. That's where the dangerous bacteria live.
I loved the fact that your business is serving the underserved. It's really very noble, and it's also part of the Sustainable Developmental Goals to democratize and have healthcare be affordable and be available to the mass market or even the poorer segments of the market.
Well, I've spent most of my working life in nonprofit companies. As a director of nonprofit, you sort of train yourself to look around you and to try to see what is a problem within my competency, within my mandate that I recognize in society. Can we do something about that? Can I find a donor who's interested in that? Let's try to mount a program. Let's try to get other people interested in this and try to make the world a little bit better place. That's a working habit that is by now fairly deeply ingrained. Maybe the second part of that is that I'm define myself as a secular humanist. And as such, it's part of my belief system that we shouldn't be causing unnecessary pain or harm or suffering. And where we can, we should try to ease or relieve that pain or suffering. That is part of my value system.
Thank you for your definition of what spirituality is to you. I totally get that. It's sort of very congruent with what you've been doing over the years. I want to now move on to a new topic, and that's about crisis. I say that crisis is a kind of setback that we encounter, and in that moment we have a choice: either we die or we get to a turning point and we adapt and pivot to the next pathway. So when you look back in your own life, I'm sure you've had some setbacks that you've had to deal with. What did you do that had you be successful in dealing with such setbacks?
It's a difficult question. Frankly, I've led a very charmed life. I have very few personal crises. Thank God. I'm happily married. I've got 3 healthy kids. I managed to have enough money to live on. I haven't had many personal crises. I mean, I've had a couple of moments of, personal danger and things like that. But
You're pointing to something interesting. Maybe it's a way you look at life that has you either be more future orientated, or when something comes to you, you don't make a big deal about it, right? And label it as a crisis and you just move on.
I think that's true. I'm this kind of person who goes, oh, okay, how are we going to deal with this? What is the best way to deal with that? What is a reasonable, equitable, effective way of getting out of this? I'm not easily or quickly label something a crisis, I would say.
That's great advice, not to label something as a crisis.
Don't overthink it. Don't ruminate on it. Don't think too much about the negative consequences, but think about what you can do moving forward.
Very good. You found it really difficult when you look back, right? To say, okay, where is that crisis? But then it's all framed by this big perspective. Let's move on. Let's find a solution. Let's not label things. Let's not belabor it or make it a negative consequence. It's sort of down to earth, being practical about it and really focused on what you want to make happen.
Yeah, and not to look too far into the future, not to think too much about what might have been. The flip side of that is also not to look at these huge, enormous goals in your life and try to reach them. More like, this is what I'm faced with today. This is what's right in front of me. Let's tackle that, and we'll see how we get through that first.
That's right. So do you have advice for young people who are looking for their place in the world, either in management or in leadership or in business? What would be the key things that they could do?
I don't know if you're familiar with the movie Bill and Ted's Excellent Adventure. It's a late 80s comedy movie. And the key phrase in that movie is be excellent to each other. And that phrase has always stuck by me. And I think that's probably not bad advice. As I said, I'm a secular humanist. As a human being, we all have inherent value because we are humans. And that's the basis underlying what we know as human rights, the recognition that humans have value and importance. And so from that flows, if you will, a responsibility for yourself and for each other. I think of that as consequential ethics. I don't judge things being ethical or not, other than what their consequences are. And so that means you don't cause, and it is upon you to ease or relieve the pain and suffering of others and work to increase health and happiness and well-being in our communities. Fight for justice. Be caring. And I encapsulate that by saying, be excellent to each other. And if I have that stand, then on a day-to-day basis, I think about what roles do I have in my life? So I'm a company director, sure. I'm a husband, absolutely. I'm a father, I'm a friend. And for all of those roles, I look at, okay, so given who I am and what I think my stance is in life, what can I do to, what sort of a husband do I want to be? So what's the piece of advice? Just to figure out what your values are and what roles you have in life, and then how you can further those values in each of those roles on a day-to-day basis. And don't worry too much about the far future, but look at the things that are right in front of you.
That's really very profound advice. And you've decoded it quite simply. Figure out what your values are.
Yeah, figure out what your values are, and then combine that with who are you in your life? What roles do you have in your life? And then figure out how you can apply those values in those roles for the next week, in the short term.
Thank you very much. So do you think people can live a simple life?
I think leading a simple life in terms of buying a plot of land and I'm starting a vegetable garden and a bunch of chickens, and I'm no longer engaging I don't think it's particularly ethical. I think, yes, you can live a simple life, but I don't think I would want to. At least not for the next 20 years or so, maybe when I'm in my 80s. I think you can live a thoughtful life, and what Socrates called an examined life. Look at who you are, what are the root causes of your behaviors, what are the patterns and the consequences of my life, and how do I improve those? So a simple life, in the sense of economically simple, I think it's almost impossible nowadays. And I think simple in the sense of isolating, I think wouldn't be ethical. I think we all have a responsibility to engage and to be part of a community.
I love the fact that you pointed out being part of a community. It's almost like it's our duty.
Yeah, I think so. As human beings, we've evolved within communities, and so much of our psychology needs that human connection. I think you would be doing yourself a disfavor if you're not part of a community. And you have the responsibility to reach out and to be supportive and be empathetic and help improve your own community.
From what you've described earlier, as well as just now, you talk about what I describe as reciprocal altruism. And I've found that in family businesses, that's actually one of their core strengths when they are thriving. They are able to set aside their individual differences and their needs for that common good of all. But then it gets lost over time. This whole notion of reciprocal altruism is something I think missing in our society these days. And I would like to see a resurgence of that kind of connection, as well as a collective focus. Now, consulting work is actually geared around it. In getting companies to embrace this notion of what they can do to work as a collective versus an individual.
Yeah, there's been an interesting body of research built up over the last 15 or 20 years about happiness, about what makes you happy. And this is solid sociological, psychological research. And you mentioned the Sustainable Development Goals or Millennial Development Goals. Someone who say, well, I'm going to do something about poverty worldwide. And it doesn't matter if you do that as a doctor or as an engineer. It doesn't matter what role you have. If you have a sense that what you're doing is contributing to a bigger goal, those are the people who tend to be happier. We have evolved to live in communities. If you feel that you are an active part of this community, improving this community and supporting and strengthening your community, that gives us a sense of well-being. And so I think altruism isn't even what is the word I'm looking for? There's a selfish aspect to it, and it's a good aspect.
It is for our own benefit.
It definitely is.
That is true. So if you had to use 3 words to describe thriving, what would be those 3 words?
Thriving. Well, I would say people thrive when they're an essential part of a warm community. And then be honest with yourself about what your values are and try to live your life accordingly. I think if you do that, then you're a long way on that road to thriving.
That's very good. Well, I want to ask you a question about sustainability. And what's sustainability for you?
That we're using our natural resources in a considered manner, in such a way that we're not running them out for future generations. And as a father, I believe strongly in that. But at the same time, it's a very frustrating that so few parts of our societies are sustainable.
That's right. And, in our work, we take on the definition that sustainability is the ongoing thriving of a living system. And that therefore it starts off with each and every one of us as individuals, the kind of mindset that we have around ourselves as a system and how we interact with the community at large.
Right.
As well.
Yeah, and I think this goes back to that responsibility towards the community that we talked about earlier. We have a responsibility, I think, all of us, but particularly those of us who live in the Western world, who consume more than our fair share. We have a responsibility towards the larger community in the world to do that in a responsible and sustainable way.
That's right. And how do you see your healthcare startup contributing towards this whole aspect of sustainability?
I must say that this is not something that I've given a lot of thought. We're not in the business of trying to mitigate global warming or sustainable resources. We'll try to be cautious of and conscientious in electricity consumption and things like that.
I was going to say that although there are 17 sustainable developmental goals, and some of them talk about equality and human rights and, even in poverty, right? So when you're serving the communities who don't have access to equal medical care or something from that perspective, then it becomes very much consistent with that whole sustainability focus, but from a different aspect.
If you're looking at it with a broader perspective of what sustainability means, then yes, we certainly fit in that. The notions of healthcare for all definitely reverberate within me and within the people that I work with. And especially because so many people that you talk to here in Vietnam about this business, the number of people who need this kind of service, who need this kind of care is really significant. And I think that it's a massively underserved group of people. And so in that sense, we're trying to contribute to sustainable development, if you will.
That's right. Well, I've appreciated our conversation. You've given me food for thought.
Thank you for the opportunity.
Dear listeners, if you've been listening and enjoying the Thriving in the Age of Disruption podcast series, as well as our Mastery Effect podcast series, we'll appreciate it very much if you can share with us the topics that are close to your heart so that we can source the relevant experts and change makers and have them be on our show. Do comment below and let us know where you are commenting from and what is it that is of biggest concern to you.